Morning. Today is Thursday, April 10th, 2025. My name is Richard Candia. I'm a business development manager for Florida Lamar Corporation, a general contracting firm here in Dade County. And this is South Dade Shoutout. I'm a board member of the South Dade Chamber of Commerce, and every week we bring this program to you to introduce you to members of our community, chamber members of our community who help make South Dade the best place to live, work, play, pray, and thrive. And today we're going to talk about something that you may have not given a lot of thought to, but if you're an employer, you may want to perk up your ears because we're going to talk about a way that you can give your employees more without hurting their paycheck and maybe even helping your bottom line. I'm talking today with my good friend Dr. Joseph Webb. Dr. Joe is a wealth management expert. He knows how to talk about employer benefits, and he's going to talk to us about this magic of how we can help employers enhance the benefits to their employees. Hello, Joe.
Good morning.
Good morning to you.
Pleasure to be here.
Failed to mention that you are a longtime member of the chamber.
Yes, I would say I'm the longest standing board member. They won't let me go. I've been a board member I'm in my 10th year now as a board member of the South Dade Chamber.
And you've done just about everything.
Served every position. Former chair, treasurer, all the like. It's been a pleasure.
No, and we're very fortunate to have folks like you. And I love when we talk all the time. You never fail at highlighting what the chamber can do for folks, and this is a perfect example.
Yes.
So let's speak in basic. Let's talk basically. An employer, small employer, large employer, can offer benefits to its employees through like health insurance. That's what we're talking about, right?
Yes, the full gamut. I know we're going to focus on one, but that's the full gamut. The chamber can offer many things when it comes to those benefits.
Now, I guess let's start with the name of this plan. What is the name of this plan that's been in existence for some time now? Give me a little bit of history.
So what we're going to talk about today is a wellness program that's been around since 2013. The proper term for it is the SMRP, or otherwise Self-Insurance Medical Expense Reimbursement Program.
Mm-hmm.
This program was brought into place at the time for 50 or more employers, companies with 50 or more employees. And the whole incentive there was to provide some type of health care, some type of benefit to pull us out of this reactionary mode of dealing with our health.
You said two things: wellness at the beginning and reactionary at the end.
Yes.
The focus then is to help give benefits so that employees, people can have better control of how they use those benefits.
Yes. Today's society, I would say a little bit less since urgent care came into play, but we're using the emergency room as our doctor.
It's expensive.
It's very expensive. And at that time, it is very reactionary. We're in some type of turmoil or some type of a real health situation that could have been prevented had there had some means and some things in place like we're going to talk about today.
Okay, so I'm going to jump around a little bit. I thought that health plans already were incentivizing the doctors and such to train us as the citizenry to use the Prime. So for me to go to my Prime, to go to my doctor, regular checkups, and to just train me.
Yes.
So those incentives already exist for the docs, no?
So what you're speaking on are incentives through the carriers.
Through the carriers.
Carriers have put more wellness programs and more incentives in place when it comes to that. What I'm talking about is a program that's going to put things in place for the employer, giving the employer options to offer benefits at no cost to them and no cost to the employee, while enhancing, if they currently have an insurance or major medical carrier in place, enhancing that program. But even if they don't have anything, we can help put that, like they call it, a starter kit together for that piece.
Adding benefits such as?
Benefits from the wellness perspective, your virtual care or virtual urgent care, a virtual primary care doctor, things like financial wellness, which is a major thing when it comes to what's happening with our student loans and consumer debt and all those things. We're also talking about a virtual dental services available, and insurance consulting is available, and even checking out your medical bill and getting service through the wellness program 365 days a year, 24 hours a day, 7 days a week in every state in real time. Now, the incentive that comes behind that, there are FICA tax savings and payroll tax savings that allow benefits like your voluntaries, like the dental, the vision, the short-term disability, and life insurance and the like. So it is very robust, and it's such a win-win. As you can see, I'm excited about it.
Yeah, and we're going to show some information later where it helps the employee. The employer, by participating, can help their bottom line while giving better benefits.
That is correct.
But we have to also remember the holistic approach. Healthier employees, less time off, more productivity, everybody's happier.
Yes.
Okay.
Yes, we're talking about absenteeism being minimized, and also presenteeism is a big deal today. That is when your body's there but your mind is not.
Ah.
And we'll even touch on the mental wellness feature that it has like no other.
I feel like you were looking at me when you were saying that. Like, okay, I'm not going to take it personal, Dr. Joe.
I know you're just fine.
Okay. Let's get back to that. Not only enhancing benefits, but giving benefits that they may not be even receiving.
Exactly.
Can we put up some of the slides there, Amber, please? I want to see what we have. I want to. The problem is I can't believe it. And you're gonna convince me now. And by the way, this is the most chamber-esque kind of conversation we've had in a very, very long time.
This is
nuts and bolts.
Yes.
Give me. Let's go with that one. This is this has your information. We're talking about who we're talking about. Should we start at supplemental insurance?
And that's the fruit. So however you like to start to provide this, I am open. We could start with the fruit. And so the fruit and the benefit side of this, those are the voluntary benefits that I spoke about: the dental, the vision, short-term disability, long-term disability. That's the fruit.
That's the fruit.
Yes.
Okay. So let's talk about the enhancements and enhancing the healthcare.
Yes.
So then how does that work?
So if a person has major medical, I always say it all the time, this program is designed to complete what they have, not to compete with what they have. So how do we do that? I'm going to give you three. There's many major ways, but here we're going to speak on three today. One of them are claims. So the way the system is set up today is our primary care physician is booked, busy, and tired. The average time to see your primary care physician is 26 days. But if you're dealing with an ailment of an everyday such, we're using urgent care. So what does urgent care have? A copay and sometimes a claim.
Mm-hmm.
That raises up major medical costs on an annual basis.
Right.
The other one are prescriptions. How we utilize prescriptions, how we're getting access to prescriptions. It could be a heavy cost. Your doctor asks you, the number one question is asked at that time, where do you normally go? There's no cost mitigation there. This wellness program, you could utilize it, and no matter where you are in what state, whatever that prescription is, you can utilize their program to get access to it. Now it's not a hit against your major medical. So those two areas right there are ways that costs are minimized, and you can use this program. It's unlimited. It has no cost to it, no copay, no deductible cost to utilize the program. So now it just buffered a major medical plan.
I'm an employer. I have 15 employees. Is that fair? Okay.
Yes.
I have an employer. I have 15. I don't have time. I've got hopefully I have a healthcare consultant that's helping me put this stuff together. How do I then access this? I'm going to repeat this a million times. Complete, not compete. I have XYZ healthcare plan offering whatever it is that it's offering.
Yes.
Give me some examples of completing.
Okay, great. So in having that major medical, most of the time you're giving limitations on visits.
Mm-hmm.
You're giving limitations on who you can see and how that actually works.
Mm-hmm.
If you have a PPO, you can adopt a primary care physician on this platform and see him or her in real time immediately, not the 26 days that we talked about. So now your employees being taken care of in a timely manner,
mm-hmm.
whether they're in Miami or in Utah. So that whole convenience feature is put in place there to enhance a person's current healthcare plan, versus utilizing the healthcare plan to get a specialist. It will be another example.
Mm-hmm.
You can utilize a specialist on this program as long as it's just consulting, unlimited usage. Most healthcare plans have a 5 to 7 cap. But every time you use that 5 to 7 cap with the specialist, there's a copay.
Sure.
No copay with this program.
Okay.
No deductible hit with this program. No claim with this program. So it'll align itself with whatever company and group number that carrier has, that organization has, and they can utilize this unlimited 365, 24/7, not only for the employee, but for his or her family. So can you see all the copay costs that are reduced and all the claims that are reduced and all the deductible hits that won't take place because of this program?
And I'm seeing where what I'm offering has been enhanced like 3 times, 4 times going down the line.
Yes.
Is there a hit against me as the employer, my premiums and that kind of thing?
There's through the FICA tax savings and the payroll tax savings, everything is covered within the program.
Okay.
And I'll say this too for the sake of the audience. I've worked with 4 other wellness companies. So I'm not speaking from this may do that, that may do this. I can give you all the differentiators from the ones that are out there. And this is the only one that has unlimited within its usage.
Okay. Okay.
Yes.
And we're going to put up your website at the end so that people can know where to access.
Yes, sir.
And we've got to find a way for people to find you. They can find you through the chamber, of course.
That is yes. South Dade Chamber. Yes.
Okay, well, I know there's a cost benefit, but before we go into that, it can't just be willy-nilly.
Exactly.
What are the requirements that I as an employer have to meet in order to participate in this?
So in order for you to participate in the program, and we're the only one, TV land, only one,
okay,
that you have to have a minimum of 2 W-2 employees. You must, and it says here you must have a major medical, but even if you don't, we can provide what's called a minimal essential coverage plan that'll make them compliant. And they must, and it says 30 hours a week, but as long as they're making between $27,000 and $30,000 a year and they're not on Medicaid, they will qualify for the program.
Is there a minimum income or minimum hour requirement?
Yeah, they say on there 30 hours a week, but I've signed up individuals that are working 20 hours a week but making $30,000 a year, and they qualify.
So W-2 employees and a minimum salary requirement. With that, I'm good to go.
Yes,
I can call you, talk to you, and see how I can help my 2 employees, and I can grow.
That is correct.
Okay. Those are the enhancing what I already am offering.
That is correct.
But you and I have talked, and this is where I'm like, get out of here, Joe. Yeah. We've talked about the additional services, additional benefits that I as an employee can now access.
Yes.
And you just talked about, you were looking at me when you said it about the mental health thing. That's one of the, because that's huge now.
Yeah, that is one of my other passionate moments. I'll even give a testimony. I've been involved in this program since 2019 when it was 50 employees. So I signed up a few companies before the pandemic. Pandemic hit, and they were using it. The companies I signed up was using the mental wellness piece. Remember I said 365, 24/7, untimely deaths, anxiety, feeling alone, extreme loneliness. They were utilizing the program and taking advantage of it. As I said, in a good way, no cost, no copay hit, unlimited usage. And had they utilized their own program, I'm even looking at some of the ones that are out there today, you get 7 visits and you have to call them for more visits. Like there's a time frame that you're going to all of a sudden feel better.
I'm going to schedule my depression around. Right. Okay.
Exactly. So this is unlimited usage. So when technology kicked in and I was able to offer it to smaller companies, I became more excited. And of course the chamber being one of them with this is, them having that access, having access to these things and being able to deal with it every day, because we still do it a lot of every day.
Sure. But there were other things you mentioned. Weight management.
Yes. Yeah.
And I think
smoking cessation, if you're dealing with
smoking cessation,
weight management, you can have a coach. You get a coach, a dietitian. All this within the program, a coach and a dietitian to help you out with that if that's a challenge.
And I'm trying not to make a ruckus in front of everyone. Wasn't there something for pets as well?
So one of the benefits you can actually get outside of this, along with the dental division, the short-term disability, life insurance, legal shield, identity theft, pet insurance by demand. I was amazed to see. And we should all love our pets, but that was something that was
something we would worry about.
Yes.
My wife and I are devoted to our little dog, and you better believe he's got
Yes.
that insurance.
So you can actually have that added and paid for through the program.
Work there. Okay. So now we've just talked a little bit about the benefits to the employee.
Yes.
Aside from having happier employees, what's the other benefit to the employer?
Thought you never asked.
Well, slow burn.
Yes, it is. It's a good thing because the employer, we currently tell them you are currently paying $1,119.96 annually. You're overpaying per employee, which is $93 a month.
Mm-hmm.
You're currently overpaying that. With opting into this and providing this as an option at no cost, you're now going to save per employee $639.96 a year, starting the first month, which is about $53 and change per employee. So I'm gonna do times 10 for the sake of the
Easy
math
math,
here.
right?
Yeah, easy math. So if it's 10 employees, that's over $500 a month in payroll tax savings.
Mm-hmm.
Times 12 is $6,000 of savings immediately for opting into the program.
So on the screen now, we're showing that an example, similar example using different numbers, but similar example. It's the program itself. It's the idea behind the legislation was to incentivize a dedication towards wellness.
Exactly. Yeah.
Use these benefits. Get these folks involved in accessing that kind of care.
Yes.
Everything to avoid the emergency rooms. Everything to avoid the most expensive ways of getting care.
That is correct.
Either getting care through an emergency room or getting care when it's too late.
That's the key. But
Okay.
that whole reactionary component is what they're actually bringing forth to put us in more proactive, preventative care mode
Mm-hmm.
without cost being an issue.
Can you go back to that screen, Amber? So I don't know if we can read this, you and I, where we're sitting.
I can now. I'm going to look at it.
Uh-huh.
I can read it. This example, TV land. I love saying that.
Yeah.
Is a real live example. This is a client that we're currently taking through the process. 600 employees. As I said, we're the only one that'll work with the less than 10 mom and pops that are out there. But I want to give you an example of how this works. If I went from left to right, as you can see, the names have been redacted. For opting into the program, I'm gonna go from right to left for the sake of it. Then you'll see where the money comes from. Going to the far right, the annual payroll tax reduction, FICA tax wise, is where the money's generated. 1220 times 12 is $14,640 a year.
Mm-hmm.
That's where it's generated. So for opting in, that savings takes place. And then as you see the $639.96, that's net of everything, all costs. The employer gets to incentivize him or herself. In this example, $383,400 a year with a 600 member employer in this program. And as you saw, 8.87 FICA tax savings. So as we move further to the left, the program itself is $125 a month. That's what that particular column is. The employer's portion is $40 a month.
Mm-hmm.
But where does that come from? That comes from the gross tax savings that they're currently overpaying of $1,119.96 per employee. It comes from there, which nets them to $639. Win-win.
It really does. And why wouldn't? Thank you, Amber. Why wouldn't an employer even participate? Give you a call and say, "Talk to me about this." Why wouldn't they?
I'll say because that old saying, if it's too good to be true, it is.
Yeah.
And as we spoke earlier, the program itself, as we see it, is 12 years old. But the idea of this program has been around for more than 25 years.
Sure. Okay.
The legislation during that time just found a way to fine tune it to allow access for tax incentives.
Right.
So it's been around.
Right.
So as you look at that, 2013 is when it came out. Of course, we know when legislation puts something out, it takes a few years to get going. So it started seeing things in 2017. And then I got involved in 2019. And then the pandemic hit. And then when the pandemic hit, before that, everything was face-to-face. No one knew what Zoom was at that time. Well, very few did anyway.
Interesting. During
the pandemic, technology kicked in and took place, which allowed more access. And at the same time, legislation lowered the minimum from 50 to 25 to 10. And like I said, we're the only one that's doing less than 10. And providing more access is what that's all about, because we're almost it's almost an epidemic of a situation when we're looking at the healthcare costs and then people under affordability and them not being proactive and taking care of themselves.
From
So
a
that's
from a policy nerdy wonky policy perspective, I can reduce my payroll taxes
yes,
by encouraging my employees to engage in preventative care. I can lower my workman's comp
yes,
claims,
that is
and
correct.
nobody wants to get into that business. Nobody down not health related workman comp issues. Those are expensive. It's all litigation. And it's because somebody made a mistake or somebody got sick or claims they got sick at the office.
Yes,
But here we're going to encourage you not to do that. Plus, if I'm like in my company, a construction company, we do good safety measures, and then we won't have those problems.
yes. So between the safety measures and also, how about offering some disability, short-term disability, or some enhanced hospitalization care in what you have, or as a starter kit, will prevent that employee from making a claim where he or she got hurt over the weekend. They bring it in on Monday.
Hmm.
It becomes a financial thing. So this is a way to mitigate costs across the board with the employee utilizing benefits that they'll now currently have versus the employers being hit with a claim on their workers' comp.
So I teach a class at my church, and one of the things that I tell the students is that it just doesn't come to you. You have to go and work towards. You have to try to learn for yourself what it is that we're talking about. What are the responsibilities then to the employee? For instance, I'm a horrible case. I can have all the insurance in the world. I never go to the doctor, so I never find out about anything, even though it's right there. So I can have all these enhancements, all these beautiful things, but yet if they don't use it.
That's a very good question. I love that. So accessibility and the ease of accessibility we've seen that allow individuals to utilize it more. So what I mean by
You
that?
got to answer for everything.
It's really good stuff. Listen, so you can the app didn't exist before 2020.
Right.
So now there's an app. You can download the app, and you could tap the app to reach someone in real time immediately. So there's no one trying to figure out when to set up an appointment. It's all the inconvenience of all this that unfortunately is a reason why people aren't utilizing the system. But you can tap the app, you can get online and reach them online virtually, or you can dial a 1-800 number.
Mm-hmm.
You get them in real time. If you have insurance, you're going to upload your group number. Their HIPAA, all the HIPAA certifications, all the IRS certifications and ERISA certifications are there. They'll have your group numbers employer for opting in. So when you reach out to them, they say, "How you doing, Mr. Richard Candia? How can we help you?" They already have your plan in front of them, and that's where they're giving you guidance in real time on where to go and how to mitigate.
Right.
So the convenience of it is really what allow individuals to utilize it more, and they're mitigating your cost savings. Did you know that an antibiotic at CVS is different than an antibiotic at Walgreens in cost? Same antibiotic.
No, I didn't know that.
They will mitigate that cost in real time for you.
Mhm.
They'll also mitigate the cost to where you can either get $1 prescription, $2 prescription, $5 prescription, and these are not hits against your health care. So the ease of use is there, and then the experience is a concierge experience. You're going to get that person that's been rated, and that person is going to give you the best care at the best cost, and they're going to tell you, okay, we see where you're heading. It's going to cost this much based on your healthcare plan.
Gotcha.
That is just beautiful hands-on
This is
service.
all participatory. That people have to just be engaged and have to take
Yes.
it. Okay.
Just tap the button and say hi, and go from there. And you'll be guided. So
Okay, so we are there's I can't even summarize all the stuff that you've given to. We have to figure out a way to get people this information so they can come and talk to you about this.
yes,
W-2.
Yep.
There is a minimum wage that they must earn, 27,000.
yeah, 27 to 30,000.
So I guess nonprofits aren't eligible then. That's
No, listen. That's when they went down
Oh.
to 2 employees, and I'm gonna give a quick caveat with that. If you're an S corp, without making it complicated, I would say you would need 4 employees so that you can take advantage of it.
Mhm.
Because S corps with the ownership is a little bit different than a C corp. A 501c is a C corp.
Okay.
So with a 501c, 2 employees, and I work with a lot of churches, pastor and his assistant, pastor and a janitor are able to take advantage of this.
Qualify.
Qualifying. We're the only one TV land. I love saying that. We're the only one that will do it at that amount with a minimum of 2 individuals. So I'm very excited about that.
My other hat is I have a real estate license, and so realtors do not earn. They're not W-2s. They're 1099s.
That is correct.
So you have a brokerage. Big brokerage will have the broker probably salaried, the assistant probably definitely salaried,
Yes.
and maybe an IT person. But the rest are realtors. They're all 1099. Can the realtors participate in some way somehow?
So there are ways that the realtors can't participate.
1099 people.
That would 1099 in this particular program specifically. No, for this, but can they participate in the wellness program? Yes.
Okay.
We can have individuals that are set up. The cost is very nominal for that, but I also have benefits for them. But I know that will be a whole other session.
That's a teaser. That's for the next one.
Oh yes, for sure.
Give me more homework. I feel I've had to prepare more for this. It's been okay. One more. Take one more tack on how the employer will benefit from this, because this is a chamber conversation.
Yes.
The chamber members are by and large mostly employers.
That is correct.
They have folks and they are trying to retain, recruit, grow. The benefits to an employer. Let's go down the list. By enrolling, there is a reduction in their FICA tax.
That is correct. Yes.
You have healthier employees. Long term, less claims on your workers' comp.
Yes.
Healthier employees are more productive.
Yes.
You're producing more. They're calling in sick less.
That is correct.
And the additional things, mental wellness, insurance for the pets. I'm sure there's a whole host of.
Oh yes,
things. There's a bunch of.
There are 44 benefits that we would basket for that employer to access to either complement what they have or make what they have better.
So just about any kind of life event that may impact me getting to work or keeping my mind on work, we can probably hopefully address.
That is very important. So let me address your employer real quick, because construction is one of my favorites. Anyone in the security field or any type of where it could be some danger is important, because showing up at work and having situations going on at home that could put you in a mental state could be a life or death situation. That's where presentism comes in. How about being able to tap the app on a break and reach out to someone because you're having a rough time, but you're at work? A lot of individuals will come into work and dealing with presentism because either they run out of sick days, or they just simply can't afford to take that day off. Well, that could be the difference in getting hit upside the head by a crane or walking off a building. Right. So having access to this in real time on a break, I need to talk to someone, or my child is being bullied. Can you tap? Can we have my child speak to someone? All the things that we will be dealing with mentally while we're trying to get through our day, you can actually reach out to them 10 times a day. I dealt with a private school with some teachers. I said, if them children are bugging you every hour on the hour, tap the app. We try to call them and get some motivation to make it through the next hour. Kind of a joke, but that's how often it could be used.
I didn't think about it. We should have talked about this really quick. The time we have left. I'm an employer. I want to engage in this and offer more benefits to my employees.
Yes.
Do I need to change my carrier?
No need to change the carrier.
Okay.
We will flow. That's where the completing, not competing comes in. We will flow with your current carrier because we're going to make what you have better. And we're going to mitigate a lot of reasons why healthcare aren't being. Let me go back to a stat. 42% of employees would rather have better benefits than a raise. So people are leaving their companies because of benefits. That's the first thing.
Can you go to there's a page there, Amber, with the participating folks, just to highlight. There you go, that one, to highlight.
Oh yes,
who you
that
work
is
with.
a very good one. I know which one you're. Yes.
So all those folks.
Yes.
So partner with your program.
Yeah, we are a partnership with all those ones, but the ones that are specifically for wellness, if you're looking at it, there is Sun Life. Sun Life is a partner. Aflac is a partner. Colonial Life is a partner. Allstate is a partner. Boston Mutual is a partner. Transamerica is a partner. They're all partners And that is where your basket of benefits will come from for the wellness component.
Got
And
it.
you see there's a couple of health insurance carriers that are on there. So this is something, tap in, TV land, tap in.
Amber, can you throw up his web, Dr. Joe's web page, please? And we'll leave it on the screen. They got to call you, Joe.
Yes.
People
reach
got to
out.
call you. Call the chamber for any kind of
Yes.
questions. They'll connect you. We will connect you to him. And folks, thank you very much for joining us. Joe, thank you very much for this.
Oh, it is my pleasure. It's my pleasure.
We need to do this one more time. And
Yes.
if we get any questions, maybe we'll just go off the questions the next time. Okay.
I look forward to it.
All right. We'll see you next week at South Dade Shoutout. Thank you very much for your time.